Welcome, everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us today. Congressman Joe Cunningham is here. We're just waiting for more folks to get on the line. We appreciate you being on the line. If you have a question, by all means, please press 0 on the keypad on your phone. 0 if you have a question, and press 7 on the keypad on your phone if you wouldn't mind presenting us with your email address so we can send you email updates of what's going on from time to time. So it's 7 for email updates. Most importantly, it's 0 if you have a question. A lot of you folks have been on these calls before with some great questions. Keep them coming. Press 0 if you've got a question. That's what we're here for, is to answer questions. So again, welcome to our telephone town hall meeting. We're going to be on for the next hour or so. If you have a question, please press 0. That's 0 on the keypad on your phone, 0 if you have a question, and 7 if you want to provide us your email address for email updates. I'm going to say this one more time, and then I'm going to hand it off to you, Congressman. Welcome, everybody. Welcome to our telephone town hall meeting. Thank you so much for joining us tonight. We're going to be on for the next hour. If you have a question, please press 0 on the keypad on your phone. If you don't, I'm going to play the Tiger Rag song. I already told the other people on that. Next, we do want you to press 7 if you want to provide us your email address, email for updates. 0 questions, 7 email updates. Congressman Joe Cunningham, take it away, sir.
All right, thank you so much, and hello, Beaufort County. Thanks to everyone for joining us for tonight's telephone town hall. This is our 11th telephone town hall responding to the coronavirus pandemic, and I am honored this evening to have Bluffton Mayor Lisa Sulka on tonight's town hall with me, and we're also joined by Dr. Brandon Traxler from DHEC, and also Ian Scott, who's the President and CEO of the Beaufort Regional Chamber of Commerce. Thanks for taking the time to join us here tonight and help to answer our community's questions. You know, since this crisis began, I've been working in Congress to pass bipartisan legislation to ease the burden that the South Carolinians are facing. And this includes loan programs and resources for small businesses and workers, direct economic relief for immigrant families, enhanced unemployment benefits, and increased funding for the states, municipalities, and hospitals. And my office has worked tirelessly to assist low-country residents. We've held 90 virtual events, assisted almost 400 South Carolinians with unemployment claims, and helped 278 individuals recover their stimulus funds, and secured millions of dollars in unemployment assistance and small business loans. So as I know you all are aware, the Lowcountry has recently seen its biggest increase in COVID-19 cases. And, you know, despite our desire to go back to normal, this pandemic, I'm afraid, is far from over. And as South Carolina continues to reopen, we try to reignite our economy, we've got to continue to be vigilant against the threat of this virus. You know, the recommendations of public health experts, including wearing a mask, staying at home when possible, practicing social distancing, wash your hands, cleaning and frequently touched surfaces, will all help slow the spread of this virus and reduce the risk of overwhelming our healthcare systems. And I think it's clear that Beaufort County does not currently have the resources necessary to conduct the rapid and ubiquitous testing necessary to slow the spread of the virus. From my conversations with constituents, I know it's just often incredibly difficult for folks to get a test, and even if they do get a test, the results seem to take, you know, over a week. I'm working with State Senator Tom Davis to make sure that Beaufort County has the resources they need. For example, on Friday, I called on Governor McMaster to request federal assistance so we can get this situation just under control, because the way it's going right now is completely unacceptable. But I'm going to continue to fight for the Lowcountry public health and the economic recovery, and ensure that we have the resources we need to do both. So I want to thank everyone again who joined this telephone town hall tonight, and our incredible panelists for taking the time out of their day to help answer your questions. Before we get to the questions, I want to give our panelists just a chance to briefly offer some remarks, starting with Mayor Sulka.
And my go Tigers, I have to start it on a happy note, but thank you, Congressman, and thank you for inviting me on this. It's the first time participant on this side, and I look forward to being on the other side for future calls. I am the mayor of Bluffton. Bluffton is the fastest growing annexed municipality in the state, and I think we rival a lot along the coast. So we are growing fast, and we actually, a number I'm not thrilled to say, we are the largest number of cases in our county, and we'd have to do things that are uncomfortable in some people's eyes to try to curb this. And I listen to a lot of medical, I listen to the medical community. So I'm thrilled to have Dr. Traxler on the call tonight. And that is exactly what you said, mask, hand hygiene, social distancing, and just, hygiene all over. And we passed a mask ordinance against some wishes of some, but it's the right thing to do, and I support it. And been a mayor for 12 years, I think, and love this town, and we just want to get past this virus and really rely on our government officials higher up than our little town to help us. And looking forward to answering any questions. Sure.
No, thanks so much, Mayor, for your leadership down there and for your service, too. Dr. Traxler, I'll give you a chance to make some brief remarks as well.
Thank you. So I am a physician with DHEC. I normally do this sort of thing, just not quite on such a large scale. Usually I'm working in the infectious diseases and working to prevent the spread of them, and also with our team that does the emergency preparedness aspect of our agency. For our DHEC COVID-19 incident response, I am serving as our medical officer, and so have been doing pretty much all things COVID since about mid-January, and certainly even had it on my radar for a couple of weeks before that. So we really appreciate the support of everyone from every level of government, from local to state to federal, to really help us get the resources we need in South Carolina, get the personnel, and really just do everything we can to combat the spread of this disease. As the mayor was saying, it really comes down to a lot of what each of us do, and that's just choosing to do the right thing, to watch out for not only ourselves, but for those people around us, and people we love and know, and maybe even people in our community we don't know. And that's wearing the masks when you're out in public or around other people outside your household, and then doing the physical distancing at least 6 feet apart, and avoiding group gatherings. Large group gatherings certainly are chances for this virus to spread easily. And I'm looking forward to answering some questions tonight as well.
Thank you so much, Dr. Traxler. Ian, you want to jump in here for a second?
Thank you, Congressman. I'm Ian Scott. I'm the president of the Beaufort Regional Chamber of Commerce, with the pleasure of supporting and advocating for 500-plus employers, primarily across the northern half of Beaufort County. Obviously, COVID-19 has had a dramatic impact on businesses in every sector, their revenues and their operations, and we're hearing from them readily. I'm happy to be part of the call and hope I can help answer questions.
Awesome. Thanks so much, Ian. Let's get these questions.
Congressman, we have a bunch of questions coming in. We do still want to collect email addresses. If you wouldn't mind providing push 7 on the keypad on your phone to provide us your email address so we can send you updates, that would be great. Jackie is up to bat first. Jackie, welcome to the call. Jackie, go ahead with your question, please.
Thank you for having me speak. Can you hear me?
Loud and clear.
Okay. So there are a lot of people walking around without masks, and although they're recommended, the governor has not put teeth in it as a mandate. So what are we doing to make sure that the governor makes it a mandate? And then also, what are we doing to make sure we have vote-in mailing in November?
Thank you so much for the question. On the mask. Well, let me start with your last question first. Vote-in mailing, I think, is important, especially during the face of this pandemic, and that's going to be up to the state legislature when they come back in session. But we requested that be addressed quickly and promptly, as no one should have to make the decision between protecting their health and exercising their constitutional right to vote. It just doesn't make sense. Now, as to your question, is the face mask, imploring the governor to issue a statewide order of wearing masks out in public when you don't have the ability to social distance, I think it's imperative, and it's something we've been calling on the governor to do for quite some time. And it's never too late to make that order. And we, encourage him, encourage others to encourage him to make this call, because it's something we've seen that's been effective in addressing this in other states. And maybe Mayor Sulka can weigh in here as to what led Bluffton to passing their mandate. I applaud her and the town council in acting. And I think it's incumbent upon municipalities to make these decisions when those orders aren't coming from the state or federal government. So, Mayor Sulka, is there something you can weigh in with?
Well, Doc, I can quickly weigh in. We as mayors are about 40% of the county. The remaining portions of the county are not in municipalities. So we work with our county council as well, and the mayors actually wrote a letter to the governor a while back about the quarantine. And it was not taken seriously by the governor, but we were able by him to do our own ordinances. So I do thank him for allowing our towns to create their own enforceable ordinances. I would like it to be statewide, but I also understand the state's a very rural state, and every little town is not the same. But we were thrilled to get a unanimous passing of the ordinance. Every council did. And there are numbers you can call if you see a situation where masks aren't being worn, and law enforcement will go out and educate and eventually cite if they do not follow our ordinance.
Let's take some more questions. Let's take Nancy next if we can. Nancy, welcome to the call. Nancy, please go ahead with your question.
Hi. First, I want to thank Congressman Cunningham for answering my email, and I really appreciate it. The second thing I wanted to know, is there anyone who's been wearing masks that has contracted the disease? I'm just curious as to how they're tracking where the certain cells are. I know in my zip code in Mount Pleasant, we're not really surging. We have done, I think, a pretty good job at flattening the curve just in my zip, but I've noticed a lot of other zip codes are just, really surging. And I'm curious as to the typical age of the people. I know our hospitals are starting to get inundated with ICU patients. Just curious how people are actually getting it.
Thanks so much, Nancy, for listening in and for that question. As it relates to mask and contracting COVID with mask, I'll let Dr. Traxler weigh in on that issue and effectiveness.
Sure. Thank you, Congressman. Thank you, Nancy. That is a great question. So there is an increasing amount of data that's coming out to support the use of mask wearing from a scientific standpoint. I mean, there was an article published in the CDC's publication called MMWR within the last couple of weeks that looked at, for example, I think it was in Missouri, 2 hairstylists or hair beauticians who both were positive. Obviously did not know they were positive, didn't have symptoms. But they were very good about masking and always made their customers wear masks. And this study showed over 100 of their clients who basically were there and getting their hair cut or done while these women were contagious, and none of them got it. Now, of course, that's not a guarantee for anybody necessarily in any situation or in every situation, but that was definitely encouraging news. There's also been a study that's published in the last couple of weeks from Massachusetts that shows that at Massachusetts General Hospital that their number of cases among employees decreased after they instituted mandatory masking of everyone within the hospital, both, patients and staff and, what visitors they had. So I don't think it is a piece of information we necessarily collect at this time from our cases to know if they always wear a mask or if they are always around people who always wear a mask. But we do have good evidence from other series that show that masks work. And then regarding the average age, in South Carolina, the average age of our cases right now is just over 41 years old. So.
Well, thank you for that. Let's try and take another question right away if we can. Let me get this one queued up if I can. Maria, go ahead with your question if you would, please, and welcome to the call.
Yes, I had a question about, statewide mask mandate, and it was already discussed. So I would like to bring important issue that not all masks work. The industrial N95 masks with one-way valve that many people are using do not protect. They were produced to protect, the carpenter or whoever, not to inhale the, pollutants, but the air that is breathed with exhalation is not filtered. So it's very important to make sure that people know that masks that look fancy and very, like professional with one-way valve do not work, because many people are using them without knowing that they do not protect other people. It protects only the person who has this mask on the face.
Thanks so much, Maria. Dr. Traxler, is anything you want to add to that as to, effectiveness of different types of masks or on that
Sure.
note?
Absolutely. And so Maria is right that having these exhaust valves does decrease the efficacy in terms of benefiting the other people around you because, as she said, it basically allows some of the virus to escape. However, it is still more protective than wearing nothing, as are many types. It's quite a continuum when you look at different types and makes and fit of masks in terms of how well they protect you and the people around you. But overall, certainly, pretty much any mask is better than no mask.
With that, let's take another question as soon as we can. Let's take Arnold. Arnold, welcome to the call. Arnold, go ahead with your question, if you would, please.
Hey, Joe, how you doing? This is Arnold Hillman down here in Adult Disney World, otherwise known as Sun City. How you doing?
I'm excellent, Arnold. Thanks for joining us tonight.
Oh, here are a couple of suggestions rather than a question. There have been, over the past year, and probably longer than that, a number of programs in different school districts across the United States where the kids learned outside. Each one of the classes was done outside. And the problem with being inside, being in a petri dish, is pretty difficult. So taking education outside, and there's all kinds of research on it, so you might want to take a look at it. Another possibility is to use very, very small centers, whether they're in churches or community centers, where kids can be handled in a much smaller area and fewer kids, and all of the masks and the washing of the hands and of the chairs and tables and so on can be handled by the people who work in the church, and that will give them an opportunity to help with the teachers coming in. Those are my two suggestions, and thank you very much, Joe.
Awesome. Well, thanks so much, Arnold. And since we got Mayor Sulka on the line, I'd like to get if she has any input on how schools intend to operate. We've seen that all superintendents of different school districts sent in plans to reopen, and most of them look like they involve hybrid plans of online learning and in school. But I know this is a big issue for parents and for students going into this next year. So Mayor Sulka, after Mayor Sulka weighs in with the input, I'd like to hear from Dr. Traxler as to her impression on what she's seen on some of these plans as schools look to reopen in a hopefully a safe and efficient manner. Mayor Sulka?
Well, quickly, the school district falls under the county control, but Dr. Rodriguez, who is our superintendent, is listening. He's doing a lot of surveys. He has found that it's 50-50 in parents wanting to go back or parents wanting to do virtual, and he's just trying to think out of the box to do what's best for the kids. We have a high percentage in Beaufort County of students on free and reduced lunch, We're not a wealthy county like so many people think we are. And, you know, there's so many concerns for those kids to feed them, to keep them, you know, really safe in a learning environment. And I know he's open to hear you if you have those comments, and I wrote them down and I'll pass them along. He's very willing to listen.
Hey, this is Dr. Traxler. So what I've seen so far is that a lot of excellent thought and consideration is going into the development of all of these plans from the ones I have seen and so forth. I know that the school leaderships, the school district leaderships are being faced with a very difficult task, difficult decisions to make and difficult tasks, especially when, as the mayor was saying, you know, it's 50-50 in terms of what people feel is the most beneficial to the children and the teachers and everyone. I have seen some very well laid out, very detailed plans. You know, it's just even the high level I've looked at them, I have been very impressed. I can tell that everyone really is making the safety and health of everyone in those schools the top priority. At DHEC, we've been providing some metrics, kind of some guidance that's not really it's not intended to tell folks what to do about the schools, but it's just to give information about the recent disease activity in their communities. It's on a county level. We've been putting that out. It gets updated on our webpage every Monday afternoon, so I think about the fourth week or so in a row today it came out. And then we also are working with the Department of Education and with the schools carefully to help develop, you know, and revise and continue to update as more is known, guidance about the safest way to operate and the what to do if there's a case in a school and all of that kind of guidance that we can help provide to the schools.
Let's take another question if we can. It's going to be Cheryl. Cheryl, welcome to the call. Cheryl, go ahead with your question if you would, please.
Yes. Thank you for taking my call. I have just a couple of questions for you. I have a good friend in Florida who is wanting to come here for a birthday, and everyone in my home is safe. We haven't had COVID, and coming from that area to our area, with us now being, you know, a definite hot spot, and them too, would you recommend travel at this time from Florida to South Carolina?
Hey, Cheryl, thanks for being part of this tonight. You know, obviously that's an important decision. You want to weigh all the facts and the science behind it. And I'm curious as to Dr. Traxler, if she's got some input that may help you make that decision as welcoming visitors from Florida into South Carolina. Dr. Traxler, piece of advice you'd like to impart upon Cheryl?
Sure, and so I will tell her the same thing that I've told even members of my own family, which is, you know, that at this time I think that travel needs to be done very cautiously, regardless of to where the person's coming from or where they're going, but certainly involving, you know, places at both ends that have significant levels of cases these days. One certainly wants to be very careful. You know, there's a number of factors that go into those decisions, and they are difficult decisions also to make, you know, such as even just how was she planning to travel, you know, how would the arrangements be, where would she be staying, you know, how close would she be around other people in the household, you know, her health, you all's health, you know, any underlying risk factors for severe disease. But overall, I've been advising, you know, even my family that to really evaluate whether, you know, it's worth taking that risk, and every person has to make that decision for themselves. But certainly, if you do travel, to still remember to maintain social distancing. It's probably even more important when you're traveling, and really wearing a mask just, you know, all the time when you're out and about or around people outside your household.
Another question comes from Angie. I think this is for you, Ian. Angie, welcome to our call. Angie, please go ahead.
Yes, please. Yes. Hello, everyone. My name is Angie Kors. I am from Somerville Embroidery, and I thought this whole COVID thing was going to be the death of me because of, with all the business being closed and everything. So I just happen to be the person that, makes lemonade out of lemons. So I started making, I do sewing and embroidery. So I've been manufacturing masks since March. So it's been really, really good. And I just wanted to share that with you. And I might also have some news. I might be working on some military contracts, doing embroidery for the military, especially for Fort Jackson in Colombia. So with that said, Congressman Joe Cunningham, could you help me with getting a small business loan so I can complete the contract and get more equipment?
Hey, Angie, it's Joe here. First of all, congratulations on your business, and thank you so much for the work. It sounds like it's providing a great service. As to small business loans, obviously you're more than welcome to reach out to our office anytime. But while we have you on the phone and while we have Ian here, maybe we'll have Ian weigh in on this specific issue. Ian, you there?
Yes, and Angie, again, I'll add my congratulations that you've been able to be nimble and adaptive in your business and are having success right now. It's certainly uneven, the impact. Not every business has been hurt to the same degree, and many like yourself are finding great opportunities, and I sincerely applaud you for that. Regarding the contract and potential financing to scale your business to meet the contract, one small business administration resource you might consider is the Economic Injury Disaster Loan, EIDL, which is open for businesses that have been impacted by the coronavirus. There are also a number of other SBA lending programs that are open and accessible to small businesses that may be worth exploring for you. The 7A loan program could be useful. Given that if you have a contract existing and are looking for financing to scale to that contract, traditional banking sector may be a good place to turn for a fairly quick loan opportunity. Again, if you already have a contract in place, that could be a conventional loan could be the best option for you. But my advice would be to begin with the SBA and the Small Business Development Center in your area may be also a good source of counsel. You mentioned being in Somerville, and I'm not as aware of the SBDC serving Dorchester County, but I'm certain that there is one, and I know that they would be a good place of support for you to identify some financing help. But again, congratulations.
Last ask if anyone wants to provide their email address to us. We have a few folks standing by to get that. You get email updates from this office on a very timely basis. So we need your email address. Press 7 to do it. 7 on the keypad on your phone. Just 1 7. Sylvia's next. Sylvia, welcome to the call. Sylvia, please go ahead.
Thank you so much. First of all, I want to thank you, Congressman Cunningham, for your successful efforts to protect our coast with the offshore drilling legislation that you introduced. I want to encourage you to keep up the good fight and help us keep our coastline safe from drilling. My question, I live in Beaufort County on the May River, and at the beginning of the quarantine, we closed down our boat ramps and kept our beaches clear of people. I've been going around noticing places where people are congregating, and we have a lot of especially young people and families congregating on our sandbars and beaches in our area. I noticed over 200 boats on a sandbar 2 weeks ago, and it's pretty crazy that they're not regulating sandbars at all because it's just a narrow strip of sand that are just jam-packed. It looks like Coney Island. And I wondered if there's anything that we can do. There are policemen in the river, but the sandbars and beaches are open now.
Yeah. Hey, Sylvia, thanks for joining us. And I share the same concerns you do, and I see a lot of troubling behavior. And before I hand off to Mayor Sulka and get her thoughts and impressions on some of these activities, I just want to remind people that there seems to be, for some people, there seems to be a sense of invincibility that they don't have to worry about. And while it's true that this virus affects people of different ages differently, we also have to be thinking about not only ourselves but our neighbors and our family. And the fact is, we have young healthy people going out that may be contracting this and be carriers of this and be asymptomatic and not even know it, and they go over to see their parents or their grandparents or their neighbors. I had very mild symptoms, and but I was still carrying it, and I could, if I hadn't been quarantined, I would have been exposed to other people. So something we need to keep in mind, that whenever engaging those types of activities, that it's not just ourselves who are putting at risk. It's our friends, our family, and people who are more vulnerable to this. So I don't know if Mayor Sulka, you have any comments on kind of what you've seen there in Bluffton or around the waterways?
Well, I recognize the voice, so it's glad to hear from someone I know. Anyway, I agree with her 100%. It's so many different organizations that control that river. It's DNR and the Sheriff's Department, and our officers are out there, but we have an MOU with the Sheriff's Department, and I know we have stopped groups at the sandbar, and if they're with a family, it's very clear with the governor, if you're with a family together, you're okay, but everyone else has to social distance. It was frustrating. Last week I heard that a state group, and I don't know if it was DNR or who it was, gave an approval for a band, a group out of Tennessee, to have a concert on a sandbar in Beaufort. And it's, they all go back home, and here our cases go up. So I'd love some help. I think DNR should be a little more active out there, and anyone on the water that has the authority to cite the social distancing. I don't know if the mask ordinance follows on outer, on sandbars and all. Not for Bluffton, but it may be for Beaufort. So, Sylvia, thank you for the question.
Does anybody else want to add anything? I'm going to take another question now. Marty, welcome to the call. Marty, go ahead with your question, if you would, please.
Yes, my name's Marty. I live in Hilton Head Island. And in 2018, the South Carolina death rate for flu and pneumonia was 17 deaths per 100,000. The COVID death rate, according to the South Carolina DHEC website, today stands at 22 per 100,000. That's a difference of 5 per 100,000, or a total difference of 260 people for the entire state. We did not force people to wear masks or close businesses or shut down voting or anything in 2018 for flu and pneumonia. So why are we destroying people's businesses, their lives, closing schools, forcing thousands in South Carolina out of work, and now we're talking about mail-in voting, which will compromise the electoral process for such a small number of people? I'd like to hear a response from that from the Chamber of Commerce.
Hey, Marty, it's Joe. I'll hop in here, and I'm glad to hear that it sounds like you're staying healthy and safe, and I hope your family and friends are as well. The unfortunate situation is not everyone is so lucky here in South Carolina. We've already seen, 1,000 deaths from this. I was heartbroken when I read about a 5-year-old a couple weeks ago that passed away from this, and so this is having a serious impact on the health of our neighbors, our family, our friends, and it is serious. And with all due respect, I'm afraid that the understating of this virus does a serious injustice to this cause and keeping our communities safe and healthy. And it remains a serious threat. And I'll let Dr. Traxler weigh in first on the health side of it before passing off to Ian, so he can address the economic side as well. Dr. Traxler?
Thank you. So One thing I want to remind you is that unfortunately, or fortunately, I suppose, depending on how you look at it, death is not the only potential negative outcome of this virus and having this disease. While many people do recover well and, go back to their normal lives, there are other people who may not die, but who are, for long-term, if not permanently, changed by this virus. We know that this ends up with some people on dialysis for their kidneys. Some people end up with what's beginning to look like maybe permanent, but certainly at least some chronic lung disease, especially if they were on a ventilator for a long time. There are a number of different factors, and we're still learning all of this. I have to remind myself sometimes that we didn't know about this virus, and this virus didn't exist in humans until, 8, maybe 9 months ago. And so we still are learning even the long-term consequences, but that's not the only, long-term outcome that can occur as a result of it. It's negative. The other thing I, would urge you to remember is that, even if it is 200 and, some odd people, each one of those people represents someone's loved one. They represent someone's family member or their friend, and each of those people is mourned by others. And so it's not just a number, but those are each individual people.
Ian, you want to weigh in on?
Yes, I'm happy to weigh in. I guess I look at this as kind of a math problem where unknowns continue to outweigh knowns. And as long as that's the case, the economic forecast for our region remains and the country remains uncertain. I'm glad that more things are getting known quickly. To the point about the overall death numbers, I think it is potentially an inadequate indicator by itself to only look at that number. As Dr. Trackler mentioned, there are other impacts from this disease, and here in the Beaufort region, we're following the guidance from Beaufort Memorial Hospital quite closely and tracking their hospital count and their capacity. We certainly don't want to see a hospital overwhelmed with patients, and we know from other places in the country that is a possibility. It has happened. And I think that's a good reason to take precautions. That said, we are very eager to keep businesses open, extremely eager for businesses to be able to remain open, and for that reason are hopeful that people will voluntarily follow guidance on social distancing, will comply with local ordinances and county ordinance on mask wearing, and will take seriously the risk both to their health and their family's health, and do the best that they can to slow the spread, allow the science and the vaccine to catch up, and hopefully minimize the risk to where we can resume more business as usual, because I know I'm certainly ready to be back there. It's an endurance challenge right now. I understand the frustration and feel it for all of our member businesses who are suffering right now too.
Let's take another question. Metellus, I hope I said your name right. Metellus, welcome to the call. Go ahead with your question, please.
Hello, how y'all doing?
You're on. Go ahead.
Okay, my name is Walkins Metellus, and I live in Somerville, South Carolina, and I'm 33, and I actually was tested positive for COVID last June, and my symptom was a high fever and chill at night and headache for 2 days. But I have 2 kids, and lucky for me, my kids were tested negative. But what I want to know about school is that the fact that the doctors don't know, the scientists don't know what the long-term impact is in the organs or your body, I don't feel like it's right to send in young kids directly to school because of economic reasons or any other reason, because we don't know the long-term health problem that the kids might have. And my second question is for the congressman. As we said, we are probably the most advanced country on earth. We're the greatest country on earth. I don't understand how for a virus for 3 months will shut America down. Like, how can we the greatest country on earth, but we can't fight a virus and like any other country? All we do is complain about the economy when people are suffering. My father-in-law passed from COVID also. I forgot to mention that. But so I would like to know a little more clarity. If we're the greatest country on earth, why we can't, like, what word can I use? I'm trying to find the right word. For 3 months, 4 or 5 months, we crying about the economy, but not worrying about other people's health.
Congressman, what do you think about what Metellus is saying? Go ahead, please.
Metellus, thanks again for joining us. And I'm sorry to hear that you contracted the virus. I'm glad to hear that you're doing well, and very glad to hear that your kids are faring well through this as well. I share your frustration with how this has unfolded, and we've obviously been demanding that the governor impose a statewide mask mandate. We're grateful for leaders like Mayor Sulka, though, who've taken up the this and made those mandates locally, which I think has made a positive impact and will continue making a positive impact. Your points on the potential long-term impacts are well noted, and I'll let Dr. Traxler jump in and weigh into that. But before that, I will tell you that we did have a significant amount of money in the CARES Act that's dedicated to a vaccine and the medical research. So, I think all these parts are moving along on different levels, and it's our hope that the vaccine will come to the market and will be available. And as a member of Congress, our job is to make sure that we have the resources available to deal with this. But I'll let Dr. Traxler speak to the science behind potential long-term impacts and all of our concern with the health and well-being of our children.
Thank you. So, as I was saying to our previous caller, there is still so much being learned. Even with the world's best scientists and best physicians and medical personnel out there, this is still, we're learning about it as we go. However, as I was mentioning, more and more research is coming out that suggests that some people could have long-term, if not permanent, scarring and damage to their lungs. Sometimes people who have their kidneys fail or having to go on dialysis, a large number of them are able to come off of that dialysis, but not all of them. For some of them, that becomes permanent. We certainly in children are also seeing this multi-system inflammatory syndrome in children, which we had the first couple of cases of reported in South Carolina just within the last week or two. Sorry, my day is starting to blend together a little bit, but we really don't know. Thankfully, there have not been large numbers of children that have had that, but we don't know as a result potentially what, if any, impacts that could have on the children who do develop it. So there are so many unknowns, but there is a little bit of evidence that there is some reason for concern, at least potentially with adults who have severe versions of the illness.
Another question comes from Aaron. Aaron, welcome to the call. Aaron, go ahead, please.
Yes, this is Aaron, and I'm from Bluffton. And I have a couple comments to make. One is about the sandbar and people going out on the boats. Well, some of us who have boats, when the governor closed down the boat ramps, yes, we stayed home, but why can we not just go out and go fishing in our own boat with our own family? I know some families in Bluffton have 5 and 6 kids, so they're not allowed to stay together. Why don't you just close the boat ramp down? My other comment is, masks do help. I wear a mask. I'm in my 60s. I wear a mask all the time because I'm in that age group. But, what about people just doing their hand sanitizing and washing their hands and at least covering their mouths when they sneeze? That seems to have gotten away from everyone. My last comment is to the DHEC person. I noticed in the counts are way up in the millions for the whole country. So on the DHEC, in the article, it always says, this is how many people in South Carolina have the virus, have tested positive. But it also says in there, which no one ever mentions, not even on the news, about this count also includes those who have recovered. So why can we not split out the amount? Say that the whole country has 3 million people who tested positive. Maybe 1.5 million of those, or even 1 million, or however many, have already recovered from it. Why do we not get that news? Thank you.
Hey, Aaron, this is Joe. Thanks for joining us here tonight, and thanks for the comment. And I just want to make a clarification. When we talk about the earlier, I'm sure you're on the earlier part of the call where we talked about voting in groups and social distancing. This is obviously it's a different scenario when you talk about going out fishing or with your immediate family members. The question earlier was large groups congregating out on sandbars, restaurants, or somewhere else on the waterways, bringing large groups of people together, which is fundamentally different. I'm a boater, I'm a fisherman, and I appreciate the need to be outdoors, especially during this pandemic, to balance out people's mental health. I mean, we have to be, we have to have some way to, to find some relief from this. But your point on what you do with your immediate family members as contrasted with large groups are two different scenarios altogether, and need to be treated differently as well. As to your comment about the mask and effectiveness and parting out statistics, I'll let Dr. Traxel address how some of these numbers are being analyzed, and your question is that. Dr. Traxel, you want to weigh in?
Absolutely, and thank you. This is something that we have been hearing a question and recommendation from the very beginning when we started reporting out more cases. And so that is why you'll go back. If you notice, we weren't putting out this recovery rate from the very beginning. It was in response to people asking that question. How many of these are considered active cases is what we would hear a lot. And I will tell you, it took us a little bit of time because it's very hard to define what an active case is. And there's no, for example, it's not something the CDC sets a definition for the way they do for if you are a case or whatnot. But so our epidemiologists and our statisticians got together and were able, using also some data from other places in the country and internationally, to come up with a formulation to give a data-driven estimate of recovery rate. So that is what is on our website. And so, for example, today we are showing that 87% of our cases and that is for ones that we had symptom onset data for, we're estimating that 87% of them at this time have recovered. And as to why the media coverage, I can't speak to that in terms of what numbers they choose to report, but we do make that information available. And it's updated, I believe, every Tuesday and every Friday on near the bottom of the demographics page of our COVID-19 website. And if you need that website, it's SCDHEC, it's SCDHEC.gov, Gov/COVID-19, COVID-19. You just head to the demographics part, and it's down near the bottom. And they'll get updated every Tuesday and Friday afternoon with the latest recovery rate.
Congressman, speaking of voting, tell us how Congress is voting right now. I mean, literally. They're going in waves. Tell us how that works. I don't think most listeners know this.
Yeah. Thanks, Kurt. I'm working here from Washington, D.C. We're in the middle of votes for the NDAA, and we're in the middle of numerous amendments that we're voting on right now. So if you hear me, pacing or if the volume changes, know that I'm walking to and from the Capitol from office for votes. But Congress has to be able to walk and chew gum at the same time, and our military, our national defense is of the utmost importance, and we need to make sure it remains strong. And we've had a lot of bills that we've passed. President Trump just signed one of my bills into law a few months ago that helps out veterans who want to appeal their claims and their benefits. And in recent past, these veterans would have to drive to Columbia or down to Savannah and appear in person to appeal these. But now they're going to be able to appeal it from the comfort of their own home on Skype or on the internet. So that's really important, especially as we recognize that a lot of our veterans may not have access to a vehicle, may not have family around that can drive them to these. So, we need to continue to, like I said, walk and chew gum, address our nation's issues, and at the same time dealing with this pandemic. So I'm in between these votes on amendments right now, but it's equally important for me to be on this call with these panelists and addressing the concerns of our constituents, and that's what I'll continue to do.
Thank you, Congressman. Berna's next. Berna, welcome to the call. Go ahead with your question, if you would, please.
This is Donna, and I live in Bluffton. And my concern is the enforcement of the mask mandate. As a former New Yorker, I've lost several people to this virus, so I'm well aware of, precautions. I've been isolating since March 1st. I get groceries delivered. I have no one in my house. I wear a mask if I do go out, and the only time I go out is to get gas for my car. I don't know why, because I'm not going anywhere, but also to frequent Parker's to pick up just a few things that I forgot that I need. They are not enforcing the mask mandate. The staff they're doing their best, and I understand that no one wants them to be confrontational with anyone. However, I was so concerned because when I was in there the other day, 2/3 of the customers, and the place was jammed with customers, 2/3 of them were not wearing masks. The guy next...
Okay. Let's talk about what Berna's talking about. What do you think?
Donna, thanks so much for joining us and for that important question. I'm sorry for the impact this has had on you personally and any loved ones or friends that you may have lost. It's just completely tragic. I'll say that it's important we enforce these mandates and these orders. And I'm going to give Mayor Sulka a chance to weigh in on how specifically Bluffton is handling this. But before that, I want to add, and we'll bring Ian in as well, because it's important that we all have responsibility in this. And I think business owners have responsibility to keep their employees safe and keep their patrons safe as well. And so we can't just solely rely on just government. We also have an enforcement mechanism with ourselves, with businesses, and so forth. So Mayor Sulka, if you want to weigh in, and then we'll kick it over to Ian to talk about how maybe small businesses are enforcing these.
Yeah, I'd be happy to, and I think I can speak on behalf of Mayor Kaiserling in Beaufort because Ian's over there, so I'll speak to both of us. And Donna, I appreciate that. I'm just like you. Depending on what store you went in, depends on if it's in the town limits or not. So I'm only going to speak about the stores in the town limits of Bluffton. When we passed that mask mandate, our chief was on our Zoom call, and we all know that what we pass, our police officers will enforce. Now, we went through about a week period of education because it's not fair to go cite right off. I think some of these businesses need education and advocacy. And when they have gone in, also calls of people not obeying the ordinance, they have gone in and talked to them and checked back, and they were abiding by our mandate. So I don't, again, we're in a weird little area. I don't know where that store was in or out of our town limits, but there's a telephone number you can call. It's on our Facebook page, and it's a county number. If you feel the need to have an officer go out, they'll find out if it's in the town or in the county, and either our officer or the sheriff's department will go talk to them. So it's not fair for the people who are abiding by it, and I know that business, and I'll make a personal call and just make sure they are following. Can I be real quick? Love that page on demographics, Dr. Traxler. I've asked that question since day one. How many of these 600 people are still failing in health? And I love the demographic page. So I plan on getting that word out to our constituents as well.
Thank you. I will pass that on to our data team.
Ian, you want to jump in and talk about small businesses or how they might be able to help enforce these?
Certainly. I'll just add that across Beaufort,